Am I audible and visible? A quick nod whether the audio visual is all good. So today we have a lot of important topics in psychiatry that we need to discuss. Yes. All right. So today we have few important topics in psychiatry binge revision. Whoever missed the yesterday's topic, we basically had part 1 of psychiatry revision yesterday on the Unacademy Plus platform in the ongoing Mnemonic course that we had. So yesterday, the 5 p.m. session, we have discussed psychiatry. So continuing that, this is basically part 2. And today we are going to quickly revise the topics of, I think one of you had asked for somatic symptom disorders, right? We'll be talking about that. We'll be talking about the ego defense mechanisms, all right, the ego defense mechanisms. Then a quick revision of personality disorders. And we also have childhood behavior disorders like conduct disorder, your disruptive mood. All those is what we are going to talk about in the today's session, all right? So मैंने recent वाले में psychiatry लिया है, a part of it is there, the second part is here. Okay, चलो let's start. Okay, let's start with the today's session, and the first topic that we are discussing is your somatic symptom and related disorders. So first tell me, what is malignant, what is factitious disorder, what is the difference between the two? Yeah, let me tell you, when are we going to do porphyria? The next we are meeting today is at 5 p.m. The next class is at 5 p.m. on the Unacademy special class. So that means it's a free class for everyone. And we are going to simplify the topic of porphyria, a topic that you should be revising like 2 days before the exam. So we'll be quickly revising all the mnemonics in porphyria in the 5 p.m. free special class. And if you are attending for first time, it might ask for a code, which is Dr. Nikita. All right. Hello. So tell me, what is the difference between malignant and factitious? In psychiatry, there are some key words that you should remember to help you solve the question. Okay. Yes. So remember that malignant is basically like money. M for M. Patient is doing it to get the money. That is external gain is what the patient has. So external gain like money or avoidance of work is what is malignant. For example, not going to internship, taking an off for internship because we have an exam or something like that, that is malignant. Okay. So falsification or intensification of symptoms for external gain. The patient is aware of the symptoms and why the symptoms are being feigned. There is poor compliance with the medical test and treatment. This is an important point. So suppose if you ask the patient that if you have these symptoms, go and get these tests done. The patient would say that, no, I don't want to get the test done, because it would prove that the symptoms are like just, false symptoms. That is why the patient does not want to get the test done. And as symptoms cease after the gain is obtained. So if the gain is obtained, like you get an off from your internship, the gain is obtained, the symptoms will go off, right? The symptoms would go off. So remember, malignant is like basically for money or some other external gain. Factitious disorder is basically for internal gain. Internal gain means basically something for self, like receiving the attention or receiving the affection. Aware of the symptoms, but lack conscious awareness of why the symptoms are being feigned. So basically, remember, malignant is external, factitious is internal gain. Okay, for internal gain, like I want to receive affection or attention, then those are produced. So factitious disorder imposed on self, that is your Munchausen syndrome. It's a chronic disorder characterized by physical symptoms imposed on oneself. Like example, multiple cuts, seizures. The patient is willing to undergo invasive procedures and tests. Multiple hospital admissions, the patient will not say ki, no, I don't want to get the test done. While in malingering, the patient will say ki, I don't want to get the test done, because that will prove that everything is normal. Here, imagine like this is, if the patient has a factitious disorder, you ask the patient to get admitted, patient would say, yes, I want to get admitted, because maybe that will get me attention and affection, right? So more common in unmarried individuals, women and healthcare workers. Factitious disorder imposed on others, that is Munchausen syndrome by proxy. Someone else, not the person himself, but someone else is imposing the symptoms. So it is generally caused by caregiver who inflicts the symptoms on another person. Right? It's basically a form of abuse. Okay? And so everybody is clear? I'll give you this PDF. I'll share it on the Telegram group. Okay? All right, so everybody, malingering is money. So external, money is external gain. So factitious is internal gain. For myself, I want attention or affection. So if you ask me to get admitted if I have factitious, I'll say yes, because that will give me attention. But in malingering, the patient will not be ready to undergo the test, right? On self and by proxy. Munchausen syndrome is basically factitious syndrome. So, multiple cuts are done by the patient to get the attention. So that is factitious. Now, what is your somatic symptom and related disorders? These are a group of mental disorders manifested as physical symptoms like pain, weakness, fatigue, but there is no intention behind it. So this is a major difference between malingering, factitious, and somatic symptom. Malingering and factitious, there is an intention, external gain, internal gain. Somatic symptoms, somatic means the body-related symptoms are there, but there is no intention, nor the intention to get money or to get an off from the work or to get the attention. Okay, so they are not intentionally produced. So what do we have? We have somatic symptom disorder, we have conversion disorder, and we have hypochondriasis. These are the major ones. Now, somatic symptom disorder, somatic means the entire body. There are multiple symptoms that the patient will have, and there is excessive anxiety. Okay, there is excessive anxiety over unexplained symptoms like abdominal pain, chest pain. There are multiple, body parts involved. And remember, this should last more than 6 months. SS, somatic symptom, remember, is more than 6 months. Treatment includes regular visits with the same physician and psychotherapy. Conversion disorder, it is also called as functional neurological symptom disorder. Conversion is basically, remember, conversion has NER. When I write conversion, remember it's your NER, that is neurological symptoms are present. Functional neurological symptom disorder. So classically, there will be neurological deficits like blindness, paralysis, and this usually follows a stressor. There is some stressor and suddenly the patient gets this neurological deficits. Aware of the symptoms but indifferent. So that is called as la belle indifference. Okay, la belle indifference is your conversion disorder. This is more common, not very important. Illness anxiety disorder is another name for hypochondriasis, right? What is hypochondriac? Hypochondriac is a patient who has excessive fear of having an undiagnosed medical condition. Like a patient saying, I have a brain tumor, even when there is nothing, right? So excessive fear of having an undiagnosed medical condition despite repetitive negative evaluations. Okay, there are few or no somatic symptoms. This is important here. In hypochondriasis, the patient might not have any somatic symptoms or few somatic symptoms, but the patient is always anxious. Illness, anxiety is there. I have some serious illness. Maybe I have a cancer, something like that. Okay, so somatic symptom disorder, conversion disorder, and illness, anxiety disorder. Somatic means the entire body. There are multiple symptoms which are there. Conversion is neurological, following a stressor. Illness anxiety is, being anxious about having a serious, having a serious disorder. Now, let's try solving this question. What do you think is, what do you think would be answer to this one? Can I able to see the live chat? ठीक है. There are a lot of mixed answers here. Let's see what is this. 27-year-old female presents to the physician due to weakness of the left leg. There is weakness of the left leg. She states that she first noticed her symptoms approximately 1 year ago. She constantly thinks about her condition and is worried it may be due to a serious occult condition. Okay? So what do we have here? Is this a conversion disorder, illness, anxiety? What is this? A review. Am I audible and visible? I think there was some issue. Okay. So a review of her medical history reveals that she has seen multiple physicians for the same problem. Extensive imaging and the laboratory work has been unremarkable. What is the most likely diagnosis? Now, factitious disorder, malignant disorder, this is not A or B because basically this should have the intention of gain. Nothing is mentioned here that the patient wants, day off or money. No external gain, no internal gain that the patient wants attention or affection. So this is not factitious or malingering. Malingering, is it primary or secondary gain? It is secondary gain. Secondary gain, money vagera, that is malingering. Primary gain is primarily for myself. That is, I need attention and affection. Primary, that is factitious. Okay. Now, somatic symptom disorder, illness, anxiety disorder, and conversion disorder. This is not a conversion disorder, even if there is weakness of the left leg. But remember, not all neurological symptoms are conversion disorder. Conversion is basically generally following a stressor. There's a stressor and suddenly the patient converts. Remember, stressor leads to conversion to neurological deficit. So there's a presence of stressor. And you have la belle indifference, like there is la belle indifference. The patient is indifferent to the symptoms. Here, the patient is constantly thinking about the condition and is worried. That means the patient is not indifferent. Okay? So, this is not a conversion disorder. Somatic symptom disorder or illness anxiety disorder. This is a somatic symptom disorder, not the illness anxiety disorder, because the patient does have the symptoms. Symptoms are present and this is present for more than 6 months and there are symptoms present which the medical science is not being able to prove why it is. Illness anxiety disorder, that is hypochondriasis. The patient generally has no symptoms and it is there is no symptoms and the patient is worried that I have some serious disorder. Nothing. Right. So look at the difference between the two. Your somatic symptom and illness anxiety. There is excessive anxiety over unexplained symptoms. The symptoms are there, but they are not explained by the test. And there is excessive anxiety. It is more than 6 months. Illness anxiety is excessive fear of having an undiagnosed medical condition. Despite repeated negative evaluations, there are few or no somatic symptoms. So if you have to choose the one best option here, go for somatic symptom disorder because actually the patient has the symptoms. It's more than 6 months and the patient is worried about it. It is extensive imaging laboratory workup is unremarkable. Okay, so remember, illness anxiety will have no symptoms, but still the patient is worried of having a very serious disorder. That is the major difference between the two. All right. Now let's go to the next one. Okay, let's go to this one. Coming to ego defense mechanisms, what do you think will be answer to this question? 15-year-old teenager comes into the clinic because of a sprained ankle, which was the result of karate injury. His mom explains that the reason he started karate was because she noticed he was being aggressive with his younger brother, and she decided karate would be a better way for him to get rid of the aggression. Since starting karate, he has really excelled at it. What is the ego defense that was employed? Yes, Monimala. So in your somatic symptom, the diagnosis would not be established. There are symptoms, but no laboratory tests are establishing the diagnosis. Is this acting out? Is this displacement? Is it projection, sublimation, or a reaction formation? Now, if you remember these terminologies, then it would be easy to understand what the answer is. The correct answer here is sublimation. Why? We will come back to this question after we quickly discuss ego defense mechanisms. So in ego defense mechanisms, remember you have narcissistic, that is psychotic defense mechanisms, and neurotic. Psychotic are only three. If you remember them, the neurotic will be the rest of them. So we have projection, denial, and distortion, which are psychotic. So remember, P for P, projection is psychotic. Okay, psychotic projection. Then you have denial and distortion. Okay, denial and distortion, these are psychotic. The rest are all neurotic. Okay, the rest are all neurotic. Next one, which are mature and which are immature. Which are mature and which are immature. So you can also remember the mature defense mechanisms as sash. What is a sash? What is the meaning of sash? Sash is that, the ribbon that someone wears. Let's say there's a birthday party or a wedding. The bride wears that, like to be bride. वो जो होता है या जो हमारे contest वगैरह होते हैं, Miss India जो winner को पहनाते हैं, that is called as sash. Remember, sash is worn by an adult. Okay, an adult wears a sash. That means a mature person. Mature adult. Sash is your mature defense. That is sublimation, suppression, and you have A, and H, right? Altruism, anticipation, asceticism, and humor. So sash is worn by a mature adult. The rest are your immature. Remember, A for acting out. Acting out is immature. The rest of the A, altruism, anticipation, asceticism, these are basically mature. Acting out is immature. Okay, acting out is immature. So if you remember mature, automatically you'll remember the immature. So remember sash, sublimation, suppression, and you have altruism, anticipation, asceticism, and humor. Now, look at the various ones and tell me what ego defense mechanisms these are. Using negative emotions in a positive way. So basically, we are converting negative to positive. Example, a person who's anxious becomes a security guard. So that the anxiety, negative, is converted to a job, being a security guard. Aggressive person becomes a boxer. That is mildly unique. That's good. See, it is sublimation. It is sublimation. Now understand what is sublimation. Sublimation जब हमने स्कूल में पढ़ा है साइंस में, sublimes means it goes into another state, like the camphor balls. They sublime. Sublimation होता है. Sublimation basically means going from one state to the other. So negative to positive is basically sublimation. Okay, that is sublimation. Next is practice of concern for others, caring for others to reduce the stress or anxiety. Let's say cancer survivors help others with the same disease. A cancer survivor helps others with the same disease. That is altruism. Altruism means, basically benevolence, the act of benevolence, doing charity, helping others. That is altruism, right? Loving the people. Next one, which is the conscious defense mechanism. Consciously. Now, let's say you give your exam and after that I ask you how the exam was. You'll be like, I don't want to talk about it till the results are out. You are consciously suppressing that feeling, right? So, done intentionally to relieve the stress or anxiety. It's not relive, it is relive. Okay, relieve. Ignoring stressful thoughts. Let me zoom this for you. So, ignoring stressful thoughts or feelings to cope. It is, I'm not going to think about that now. So for the time being, I don't want to talk about it. So this is very conscious. So remember that suppression is a conscious defense mechanism. It's a conscious defense mechanism. ठीक है? उसके बाद में relief of anxiety with jokes or laughter. Jokes or laughter is a humor. So medical student jokes about both studying, or let's say a bald person says that, so my head is shining because I am bald. So making the laughter or joke about the anxiety, that is humor. Okay, that is humor. So all these are basically your mature defense mechanisms. You have sash, sublimation, altruism, suppression, and humor. Okay, these are mature defense mechanisms. Now, going to the other defense mechanisms, child with sick parents misbehaves at school. Basically, a person avoids the emotions by bad behavior, attention seeking, socially inappropriate behavior. What is that? I think everywhere you would think that it's me, it's me, it's me. There are multiple disorders that you would see in yourself and in the people around. Yes, this is acting out. Okay, this is acting out. अंदर कुछ है basically acting out in a wrong way. So bad behavior, that is acting out. Okay, acting out is a bad behavior. Refusing to accept the unpleasant reality. Patient thinks doctor is wrong about the diagnosis, right? So that is basically denial. I am not able to accept it. That is refusing. Directing emotions to another person. A patient angry at doctor after injury. So किसी को injury हुई, एक accident वगैरह हुआ, गाड़ी को ठोक दिया. That anger the patient removes on the doctor. So from that one who with which you had an accident, उसके बाद आप doctor पे displace कर रहे हो, that is displacement. Classical example like your HOU or HOD getting angry on the resident and resident getting angry at the intern, and the intern you going home and getting angry at your younger sibling or your parents, that is displacement. So basically we are displacing that anger from one person to the other. This is not projection. What is projection? What is projection? Projection matlab, if I am wearing red glasses, I will see the entire world like red. Whatever I have, I see in everybody else. Suppose the husband is cheating on the wife, right? But the husband feels that the wife is cheating on me. So that is projection. Okay, that's the difference between projection is, remember, like projector. You know, whatever you will have, that will what will be projected. Okay, self on others. Detachment from reality, patient may lose track of time. That is sudden onset. That is basically detached with the flat affect. That is isolation. We isolate ourselves from the reality. Okay. Next one, forgetting the difficult period of childhood, like a childhood abuse. Thoughts repressed to avoid the guilt. That is repression. Understand the difference between repression and suppression. Repression is unconscious, suppression is conscious, right? So when you have classical history of an adult not remembering the childhood abuse, that is repression. It is unconscious. Thumb sucking, chewing pencils, what is this? Failure to develop beyond a childhood growth stage, like an adult having the habit of thumb sucking. It is fixed at a childhood age. This is fixation. This is not regression. Okay, this one is this one motivated forgetting. This is repression. Okay, this is fixation, not regression. Do not get confused between the two. What is the difference between fixation and regression? See, fixation matlab during the development, someone got fixed at that stage. Thumb sucking, many of the children do in their childhood, and someone is not going beyond that point. That is fixation. Regression means going back. Suppose an adult, because of the fear, now having enuresis, bedwetting, that is regression. Okay, that is regression, right? Let's say that a child whose parents have got divorced. Previously, the child used to sleep alone, but now after the divorce, the child cannot sleep without the mother. That is regression, going back to the previous stage. Okay, going back to the previous stage. So remember, regression means going back. We have grown over that time, like a child sleeps with the mother, but when the child grows, the child can sleep independently. But now the child cannot sleep, wants to sleep with the mother only. That is regression. Fixation matlab a child has a habit of thumb sucking and it goes on into the adulthood. Never left that. Okay, so that's the difference between fixation and regression. Okay. All right. Going to the next one. Okay, going to the next one. What is this? Emphasizing positive thoughts or memories. Classically done with childhood events like our family vacations were always the best. Our family vacations are always the best. Like, always emphasizing the positive thoughts. What is this one? Is it idealization? Is it identification? Is it isolation? What is this? So whatever happens in my life, it is like idealization. That is the best. Okay, that is the best. So idealization. Mimicking behavior of someone else. Like child behaves like school bully with the little sister. Child behaves like other child. This is identification. So I identify myself, maybe let's say with Kareena Kapoor. So I'll do like her. Someone else identifies with Amir Khan, तो हम उसके जैसे करेंगे. So identification is identifying yourself with someone else. Avoiding emotions through reasoning. Reasoning requires intellect. Remember, that is intellectualization. So patient starts studying about lung cancer after being diagnosed. So the patient is trying to develop a reason. Okay, that's a reason. What is the next one? Person describes rape without expressing sadness. Where did this go? Just give me a minute. Person describes rape without expressing sadness. There is no sadness. That is isolating a distressing or memory event. That is isolation. What is passive aggression? What is passive aggression? Passive aggression is aggression which is shown passively. Somewhere you cannot show the aggression like very, in an active form. Let's say in your internship you don't like a resident and you cannot show the aggression very openly. So passive aggression would be not going to the duty or going to the duty late or not doing the task that the resident asked you to do. That is passive aggression, right? That is passive aggression. So conflict with others in a non-confrontational manner. That is passive aggression. All right. Now, next one. What are the other ego defense mechanisms? Distorting events so that the outcome is positive. I am glad I got fired. I needed a change. What is this? This is rationalization. So basically, a person rationalizes something. For example, let's say, I am glad that the INICT exam did not go well because anyways, I did not want to go into central institutes. I am targeting NEET PG, right? I'll get a good rank in NEET PG. So that is rationalization. So distorting events so that the outcome is positive. I'm glad I got fired because anyways, I needed a change. Second, opposite behavior, that is a reaction to unwanted feelings. Remember, every action has an equal and opposite reaction. Remember, opposite is basically reaction. Let's say that woman despises mother but throws a big party for the mother. Someone whom you hate, you try to show the affection, that is reaction formation. Someone, let's say in a school, in a college, a boy loves a girl and a boy teases that girl. The same boy teases that girl. So that is reaction, doing opposite actions, right? Doing opposite actions. Regression is going back, reverting back to behavior of younger person or child. That is stressed adult watches cartoons from childhood. That is going back to childhood. Sick adult wants parent to stay in the hospital with them. Adult wanting parent to stay, it's a childhood thing. So that is regression. Splitting. Basically, splitting is like black and white. It's either very bad or it's either very good. It is extremes. And so categorizing others at extremes, that is wonderful or horrible people. There is no gray zone. It is black and white. Patient likes a doctor but hates the nurse, right? These are extreme. So this is splitting. What is projection? Projection means, as I said, projecting yourself to others, attributing feelings or emotions to others. Okay. So cheating husband accuses wife of cheating. Husband is cheating, but he accuses the wife, right? So that is projection. Okay, that is projection. So these are your ego defense mechanisms. Quickly tell me which are the psychotic defense mechanisms. Let me add some slides here so that we can write. Okay. Tell me, Which are the psychotic defense mechanisms? Psychotic is PDD. What is PDD? It is projection, denial, and what is the other D? Projection, denial, and what is the other D? Is it distortion? Is it displacement? Splitting nahi hai. Projection, denial, and distortion. Okay, it is distortion. What is projection? Projecting yourself to others, right? Projecting yourself to others, that is projection. Denial is not accepting. If a person has been diagnosed with cancer, the person says, no, I cannot have cancer. That is denial. Distortion means distorting the event, like, being fired and the person saying, I'm glad I got fired because I needed a change. Okay, that is psychotic. Which are the mature defense mechanisms? Mature is SASH. SASH is sublimation, altruism, right? You have a suppression and humor. Out of that, the only conscious defense mechanism is suppression. Remember, suppression is conscious, not talking about the exam till the result is there. That is a conscious suppression. Okay, that's a conscious suppression. All right. So these are the defense mechanisms. Now going back to the question that we were discussing, the MCQ that we had. Now look at this question and try to answer. 15-year-old teenager got a sprained ankle because of karate. Why did he go to karate? Because he was aggressive with his younger brother. Right. And he excels at it. What is the ego defense mechanism? Tell me, what is acting out? Acting out is a bad behavior. Okay, it's a bad behavior in response to some stressor which is going on in the life. Right. The example that we had, a child beating other children in the school because the parents are fighting. That is a bad behavior. Displacement, since from the first person it is going to second person to third person. So the anger is going from first to second to third. Projection means projecting yourself to others, right? Projecting yourself to others. Sublimation means converting a negative to a positive. Reaction is equal and opposite reaction. So it is opposite action. Now, why this is not acting out? Why this is not acting out? The child is aggressive with his younger brother, and that's the reason he went into karate and he excelled at it. So basically the negative feature, aggressiveness, has been converted into positive, that is excelling at karate. So the answer is sublimation. This is not acting out because the child is not doing this aggressive behavior because there is some stressor. It is just his personality, right? This is not displacement because the child is not aggressive with the brother because the father, ऐसा नहीं है कि father is angry on the child and then he is angry at the sibling. Displacement will have at least 3 people for causing the displacement. This is not projection and this is not reaction formation, right? It's not that the child loves the sibling, but he is being aggressive, showing the opposite. Even that is not there. So the answer here is sublimation. Okay, this is sublimation. Okay, is this clear with everyone? Okay. Now let's go to the next one. Okay, let's go to the next one. What is the next topic that we have to discuss? What do we have? Okay, what do we have as the ego defense mechanism? Am I audible and visible? Yeah, okay. Sorry for that interruption. See, in OCD, what is the ego defense mechanism that functions is reaction formation and undoing. Tell me, what's the difference between reaction formation and undoing? Reaction is opposite, equal and opposite. Like we said, if I hate someone, but I'll show the action which shows that I love that person, that is reaction formation. Undoing means whatever I have done. Let's say I love my husband. In the morning we had a fight, but then I felt guilty about it. So in the evening, I cook for him his favorite dish, right? To compensate for something which I actually did not mean. right? That is undoing. So basically neutralizing an act that was done. Okay, that is undoing. So that is your difference between reaction formation and undoing. Okay, reaction formation and undoing. All right. So remember that OCD is basically, you can remember as R, OUR, hour. That is in OCD, it is undoing and reaction formation. Okay. So this is R. Okay. Phobia, it is displacement or it can be inhibition as well in phobia. So again, remember the mnemonic, that is PID. In phobia, there is inhibition and displacement. Okay, inhibition and displacement. Remember, yesterday also we had seen the mnemonic of PID. What was that? PP valid disorders, I is your 1 month, D is your 1 month, panic disorder, PTSD, delusional disorder should have a minimum duration of 1 month to be diagnosed. Okay. Neurosis is regression, not repression. Neurosis is regression. Grief is denial. If there is something sad which happens in someone's life, first we try to deny. नहीं, ये possible ही नहीं है. If a woman's husband dies, the first thing is the woman denying. That is denial. In grief, there is denial. Borderline is splitting. Right? Borderline is like a border between the black and the white. Okay, that is a borderline disorder where you have the history of self-harm, right? The person categorizing the people as very good or very bad, best or worst. Splitting is borderline. We split by a border. Schizophrenia is projection. Okay, schizophrenia is projection. Projecting your feelings to someone else. Remember, when I write schizophrenia, schizophrenia is projection. Okay, that is projection. Enuresis, regression, right? Bedwetting is a childhood thing. That is regression. Okay, that is regression. So this is about your various ego defense mechanisms in the various disorders. Okay. Now the next one, personality disorders, I'll do in some other session. I've already taken a session on that. What I wanted to discuss here, okay, let's try solving this question. And then I have the childhood disorders that I want to discuss. What do you think will be the answer to this? This is a topic that we have already discussed. What do you think would be answer to this one? B. Okay. So psychiatric questions are a bit confusing. I see one of you getting it right. So majority of you think it is B, that is internal gain. Where do we see internal gain? Internal gain is factitious disorder. Basically, the person wants attention or affection. Let's try solving this question. 55-year-old man arrives at the clinic complaining of abdominal pain. He states that the pain started today and he's unable to move very much because the pain is so intense. Suddenly, एक कोई symptom आ गया. He denies exposure to contaminated food, not seen any blood in the stool, no nausea, vomiting, diarrhea. Basically, he asks for a doctor's note to miss a few days of work. What does he want? He wants a certificate from the doctor because he does not want to go for work. So what is the gain that the person has here? This is external gain, right? This is external, getting money or getting an off, right? This is external gain. So this is malingering. Okay, this is malingering. Physical examination is also normal. The physician recommends that the blood be obtained to investigate his condition, but the patient refuses. Very important. Here the patient is not ready to undergo the blood test. While in your factitious disorder, if you ask the patient to get admitted, hospitalized, the patient would do it happily because that will gain him attention or affection. Right. So this is another important point here. So the diagnosis here is malingering. The diagnosis here is malingering. Is it unconscious motivation? No, this is a conscious motivation. External, getting a day off. Internal gain, external gain. Is it chronic? No, it is like acute onset symptoms just because I want an external gain. So A, B, C are out. Is it self-limiting? Yes, it is self-limiting. Now, if the doctor gives a note to that person, this person is not well and cannot come to work, the symptoms will go off, right? That basically means that it is self-limiting. Okay, it is self-limiting. The symptoms will go off once the patient's purpose is solved. Once the patient gets the certificate, it is self-limiting, right? The symptoms will go off. So the answer here is self-limiting. Okay, the answer here is self-limiting. All right. Okay. Now answer this question. What do you think is the answer to this one? Okay. What do you think is the answer to this? I don't see any correct answer here. Okay, Pankaj, I'll save the annotations and then I'll share this. See, some answers, correct answers, finally I've got here. So, random person, Staffy, Divyanand, absolutely right. This is C. Okay, the answer here is disruptive mood dysregulation disorder. Why? Why this is C? Why this is not A, B, or D? Now, again, let's discuss this childhood anxiety and behavior disorders and then we'll come to the question. Conduct disorder, remember the mnemonic for that, like conduct disorder, CD is your CD, there will be criminal deeds. Okay, there will be criminal deeds in conduct disorder. So for conduct disorder, it should be more than 6 months. The pattern of behavior, let me zoom this, it violates the basic human rights of others and breaks the societal norms, like, stealing, theft, aggression, cruel acts. If it is after the age of 18, then it is antisocial personality disorder. So basically, conduct disorder is very similar to antisocial, but this is after 18 years of age. And if the person is less than 18 years of age, then it is your conduct disorder. Okay? Oppositional defiant disorder, again it is more than 6 months. It should be more than 6 months. There is angry, irritable mood, argumentative, defiant behavior to authoritative figures and often vindictive. No criminal actions would be there. There are no criminal actions, but remember that oppositional defiant is basically openly defiant, like not listening to the authoritative. अगर आप बोलोगे ये करो, I don't want to do it. So openly defiant. Okay, openly defiant, angry, irritable mood, arguments, all those would be there. Then we have disruptive mood dysregulation disorder, onset less than 10 years old. Basically, DMDD has explosive tantrums. Okay, there are tantrums in DMDD, disruptive mood dysregulation disorder. There is pattern of explosive outburst of anger, maybe more than 3 a week, verbal or physical, disproportionate for the situation. थोड़ा सा कुछ हुआ, बहुत ज़्यादा explosive tantrum हो गया, right? Incongruent with the developmental stage, like not expected from that age. Selective mutism, remember it is more than 1 month. Mute for a month. Remember, mute is for a month. It is more than 1 month. Basically, anxiety disorder, more than 5 years old, at least 1 month. There's the child can talk. Normal language and speech abilities are there, but only silent in certain situations. So that is selective mutism. So like in impaired functioning in school or social settings. Like in the school, if you ask the child to talk, the child will not talk. But at home, the child can talk. So basically, this is selective mutism. It should be there at least for a month. Separation anxiety means the anxiety of getting separated from the parent. Again, it is more than 1 month. An anxiety disorder characterized by excessive worry surrounding an attachment figure, like being separated or harm coming to the figure. तो उसके सपने आएंगे, nightmares would be there. Anticipation of separation will cause nausea or headache. Right, there will be factitious complaints to avoid the separation. Factitious complaints can come. So this is your separation anxiety. Now let's go back to this question now and now try to answer the question. Okay. So now you have 8-year-old boy brought to the clinic because his mother is worried about his behavior. There is an incident in which the patient lost a game of chess and began yelling and screaming at the friend he was playing with. She states her son does this sort of thing often, but is really kind and happy most of the time. Which of the following disorders this boy has? So what is this? Is it a conduct disorder? CD is criminal deeds. Is there any criminal deed here? The patient is just shouting. There is no theft, right? There is no theft or anything. This is not a conduct disorder. Is it oppositional defiant disorder? Oppositional defiant is openly defiant. Openly, like being very authoritative, not listening to anyone. But here it is given that the child is kind and happy most of the time. So this is not oppositional defiant, right? This is disruptive mood dysregulation disorder. Suddenly the mood gets dysregulated and it leads to disruption. So basically here there are incidents of explosive tantrums. Suddenly explode hoga, tantrums honge. Like we see in this case, the onset should be less than 10 years and it is disruptive mood. Basically this is incidents happening. Okay, this is incidents happening. Antisocial is always more than 18 years. Here the child is 8 years. And antisocial again is like your criminal deeds. Okay. So the answer here is disruptive mood dysregulation disorder. So the mood is dysregulated at some incidents and it disrupts. Okay. Then there is explosion. There is explosive tantrums which are there. Okay. Is this clear with everyone? Right. Remember conduct disorder, criminal deeds, antisocial, criminal deeds. Conduct is your less than 18. Antisocial is more than 18. Okay, antisocial is more than 18. Okay. So yes, so we'll stop here for this session. And if you guys need a revision of personality disorders, do let me know. We can do that in one of the other sessions. And 5 p.m. Okay, we are meeting today at 5 p.m. on the Unacademy app, basically for a special class. Okay, special class means a free class where we will be discussing the topic of porphyria. And if you are asked for a code again to enroll, you can use the code Dr. Nikita. The link is shared on the Telegram group. Okay? So that is about the today's session. Thank you so much. I hope you have got to learn and revise some important points with this session, especially the ego defense mechanisms, right? The somatic symptom disorder and the childhood behavior disorders. These are the topics that we have discussed today. Okay? Psychiatry drugs need to be done. We will do that maybe tomorrow. Okay, the important points in psychiatry drugs. All right. Thank you so much. Goodbye. Take care and keep studying, keep revising, and keep